Shark bite piercings. What you should know before getting them done. Coming up next on Consultations by a Piercer, episode number 37. For those who are new to the channel, first off, welcome to the Body Piercing and Tattooing channel. Hope you're enjoying the videos. Hope you're finding them helpful and useful, but you might not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Now, the piercing grouping we're talking about today is either 2 snake bite piercings or groupings or 2 spider bite groupings. It's basically 4 on your bottom lip. Done starting with the outside, usually equal or positioned in alignment with your nostril, though sometimes they're done outward. Depends on your anatomy and what looks good. These can be done with rings or with studs, and we'll get into that later of some of the advantages and et cetera later on. But I think it's important that you should know that these can go either way. Average healing time, 8 to 12 weeks, during which time for the full healing period, I'm going to suggest that you clean it twice a day using a sterile saline spray. Personally, I like NeoMed's Piercing Aftercare, the kind that comes out in a fine mist. However, if you can't find that or that's not available in your area, the main things you want to look for is that it is in a pressurized can. And it says on there, sterile saline solution. And when you turn it over and you look at the ingredients, the only thing that's listed is sodium chloride and water. Nothing else. Now, if it's the kind that comes out in a fine mist, just mist both sides, leave it alone. Then pat it dry after about 5 minutes. If it's the kind that comes out like a squirt gun, you're probably going to want to do compresses. Take a sterile piece of gauze sponge or a clean paper towel, fold it up, saturate it to the point where it's damp, and then lay it against the piercing area for about 5 minutes, and then pat dry. The other thing I suggest doing throughout the healing period is at the end of your shower, pull your hair and everything out of the way and just let the water flow over the piercing areas for about 30 seconds. What we're doing with the saline cleaning, the sterile saline, and with the rinsing in the showers, we're removing that discharge that hardens and collects on the jewelry. The reason why we want it off there is when the jewelry moves or shifts, it can be very uncomfortable, and it also can agitate the piercing and lead to issues. If you have a situation where it seems like there's an excessive amount of it or it just doesn't want to come off, go see your piercer and have them clean it for you. And they may also need to take a look at it because there might be something else going on. Now, that covers the outside. For the inside, you need to take care of it for the first 2 weeks. I suggest rinsing twice a day for about 30 seconds with an alcohol-free antiseptic mouthwash. Personally, I like Biotine antiseptic mouthwash. The other thing I suggest doing is rinsing a couple times a day with sea salt and distilled water. You can warm up the water a little bit if you want to for about roughly a minute or two. Just rinse, swirl it around, spit, and repeat that a couple times. Do those only for the first 2 weeks. After that, stop doing it. Speaking of things you don't want to do or stop doing, cross-contamination prevention. Wash your hands before you handle the jewelry. The only time you really need to have any contact with the piercing during the healing phase is when you're checking the tightness of the ends. Do not mess with it otherwise. No oral contact, deep mouth kissing, or sexual contact for a minimum of 8 weeks. Understand that you are more acceptable to STIs even after the piercing is healed, or during oral sex mainly. So you switch partners, practice safe sex the way you are supposed to. Do not stick unclean objects in your mouth, pin caps, toothpicks, camera lenses, other people's dirty fingers, sandwiches you find on the highway. Do not do that. Keep your food utensils clean and do not share food items or utensils with other people. It's a good idea to start with a fresh toothbrush the night of the piercing, just to be on the safe side. Now, keep your environment clean. Clothing, bedding, towels, anything that may come in contact with the area needs to be cleaned on a regular basis. Do not swim. I know you're going to hear a lot of conflicting things on the internet, but the reality is anytime you submerge that piercing in a body of water, you are taking a risk that since it's still an open wound and you cannot swim without ingesting water, that you're going to end up with an infection. There's no way you can find a body of water that's large enough for you to submerge your whole body in and move around that isn't full of microorganisms, regardless of how well it's treated or how pure the water is. That's just a fact of life. Keep pets away from it. Don't let them sleep in the bed with you, especially those smaller animals like to sleep up by your face. Now let's talk about trauma and abuse and reducing swelling. These piercings are prone to swelling, like any oral piercing, usually occurring normally in the second or third day after the piercing is done. To reduce trauma, do not sleep on the piercing. Do not spin it. Do not rotate it. Do not play with it. Leave it alone. For the first 2 weeks, you want to cut down your intake of tobacco, alcohol, cannabis, hot and spicy foods, citrus drinks, carbonated beverages, vaping, anything that may agitate the mouth. If it hurts to ingest something, do not ingest it because it's going to lead to more swelling. For the first 3 to 5 days, it's a good idea to be on a soft food diet. Things like yogurt, smoothies, ice cream, nutritional shakes, baby food, applesauce, pretty much anything you can swallow whole or melt in your mouth. You can greatly reduce the swelling by gently sucking on ice chips for the first 24 to 28 hours. Of course, cutting down the intake of all the things I talked about earlier. Staying hydrated, especially throughout the night when you naturally dehydrate. Drinking lots of cold liquids. If you've never had issues with anti-inflammatory or over-the-counter anti-inflammatories, they're fine. They can help reduce it. The last thing is sleep with your head elevated above your heart. This will cut down on the amount of blood flow in the area and thus cut down on the amount of swelling. Once the swelling is gone, you can slowly start to wean yourself onto solid foods. Stick with kind of simplistic things that you cut up into small pieces and shove back into your molars and chew very carefully. It can be very frustrating at first or annoying or sometimes painful. Give it time. Be patient. Be cautious. If it takes you half an hour to eat a meal, it takes you half an hour to eat a meal. Eventually, it'll get to the point where it feels more natural to have that jewelry in than to have it out. The other thing is once you downsize the shorter jewelry, the whole thing gets a lot easier. And you should do that in roughly 4 to 6 weeks after the piercing is done. We always have to talk about risks when it comes to oral piercings. There's always a risk of enamel erosion, gum erosion, and softening of the bones inside your mouth. You can greatly reduce it by having the proper placement, but you have to understand since there's 4 of them, there's an increased likelihood of contact and an increased likelihood of problems. And usually when these problems arise, they're irreversible. So the minute you notice any type of issues with this, you need to remove the jewelry immediately. The thing is with this is one of the things that's going to make life a lot easier and reduce the amount of swelling is having the proper size jewelry in there. So downsizing if you were pierced with labret studs or even rings can reduce the amount of possibility or risk of problems. The other thing is jewelry coming unscrewed and you eating them, basically with a mouthful of food. And there's 4 of them, so that just quadruples the risk. Always check the tightness of balls or ends whenever possible. I usually suggest doing it weekly just to be on the safe side. Now let's talk about placement, angle, the styles of jewelry. As I mentioned at the beginning of the video, these can be pierced with circular jewelry. That's the way we did it for years, depending on what the client wanted. What you need to do is discuss with your piercer what your end goal is. What are you going to be more prone to wear? Studs or rings or both? If you're going to be getting only studs, best option is doing it with labret studs with a flat disc, straight through, below the gum line or above the gum line. If you were planning on being able to switch back and forth from one to the other, labret studs done is your best option. Pierced as high on the lip as possible so that you can buy rings that are going to fit comfortably around the top of your lip. If you only plan on wearing rings, you can get this done so that it's more outside the mouth and more vertical. Think of a vertical labret where it's more outside the mouth and not as far in. This is going to reduce your likelihood of enamel erosion, gum erosion, and softening the bones because there's going to be less contact with teeth. The disadvantage is doing it with circular jewelry is going to increase probably the healing time. It definitely increases the risk of issues, and it's going to be much more difficult to heal. Another option would be with a curved barbell. With some people that does work, some people it doesn't. So talk to your piercer about what angle is going to work best for you and your end goal. When marking the piercer will often make you make faces and talk. What they're trying to do is determine how much movement there is and where that piercing may have contact with teeth and gums. Also, they want to see how it naturally moves on the face and what it looks like. When looking at the marks, look at them up close, of course, but also look at them at arm's length. Most people will not see you this close, but they will see you at arm's length or further, unless they're, a close talker. Now, as far as doing these, you can do them in stages, like do one side or maybe do a set and then another set. It's always best if your end goal is to have the full-on shark bites to go ahead and mark them all out in the first setting. So you have that whole thing planned out and you have an understanding of how those piercings, or at least a basic understanding of how those piercings are going to fit into your face. Take a photo of it so that the next time you come back, go, yeah, this is what we're going for. Whenever it comes to jewelry, check the ends at least once a week. And also downsize. Downsizing if it's Libre style studs or a curved barbell or even rings in some cases is going to greatly reduce the amount of contact it's going to have with teeth and gums. And it should be done in roughly about 4 to 6 weeks after the piercing is done. Unless you're having a lot of issues with it in that first month, then you may want to do it sooner. Now let's talk about pain in the piercing experience. This one I'm going to say is between a 2 and a 6 because I've gotten a lot of mixed reviews on this. Especially if you're sitting down and doing 4 piercings at once. The other thing is with 4 piercings at once, it kind of creates a situation where it may be a little too taxing and prolong your healing period because your body is really dealing with too much at once. It's usually a better option to do one side, then do the other side, or do 2 and then 2 instead of doing them all in one sitting. With these, I do use forceps. We clamp it, inject the needle in and through from the outside. To make sure that we hit that dot correctly and our angle is correct. Then we remove the forceps. We push the needle out into the mouth using a guide pin that's usually threaded. Thread on the jewelry, push it back through, then put that end on. Usually the part that takes the longest is closing the jewelry. That can be a little complicated. With rings, it might be a little quicker because you might be using catty bead rings or beaded rings, which are a little... You don't involve a guide pin in most cases. But yeah, for the most part, pretty quick piercing, not very painful. Now, it's not uncommon immediately afterwards to have some throbbing and aching. Also maybe some slight bleeding. This is especially true of the piercings, it seems like, that are more vertical. It seems like they come in contact more or have a higher risk of hitting blood vessels and thus bleeding a little bit more. Usually this only lasts, the throbbing and aching and the bleeding will only last a few minutes, if that long. Anatomy. Of course, there's better anatomy and there's okay anatomy and there's anatomy that you probably shouldn't do it. It really depends on whether or not you have the space and your teeth are far enough away from your lip and etc. that we really take into account when it comes to anatomy. Also, whether or not we're going to be able to go above the gum line or below the gum line. We want to avoid right on the gum line just basically because that's going to have the most traumatic issues. But most people can get these done. Well, now let's finish off with what you should consider before getting it done. First thing is this is 4 piercings. That's a lot to deal with at once. Doing it in stages of 2 is usually a better option. Understand that the risks are 4 times it would be of a normal lip piercing. So take that into account that you're at a higher risk for problems, including enamel erosion, gum erosion, and softening of the bones in your mouth. This will affect eating and talking for at least a week and a half, maybe longer. It varies from person to person. But you should plan ahead, have that what you need for your diet on hand, possibly eliminate any speaking engagements or if you work and you have to talk a lot at work, maybe taking 3 or 4 days off and getting it pierced at the beginning of that break is usually a better option. Downsizing. Plan on downsizing in advance. Just put it in your calendar and make sure you do it on a timely basis. You're going to thank me for it. It's going to make your life easier. It's going to be less of a pain in the butt. It's going to have less contact with your teeth. And in the long run, it's going to be a much better fit. Upcoming dinners and events. If you have an event or a dinner coming up that you have to speak at, or you're going to have like, I don't know, a bunch of steaks or something that involves a lot of chewing, that you're going to want to enjoy, I would suggest waiting until after that event to get these done, or getting them done far in advance of it so they're well healed by the time that event comes about, because you're not going to be able to eat everything you want to, and it may be uncomfortable. Are you going to travel? This is another thing you want to consider. Maybe you go on vacation or business or what have you. It's best to wait until the piercing's healed, or to get it done after you're done traveling. A couple different reasons. First one being is that you're going to be in an environment more than likely that you can't control how clean it is. It's also an environment where you may be introduced to pathogens you've never been introduced to before, and you may not have the immunity, so that makes more acceptable infection. There's the additional thing of just dealing with the hassle of healing a piercing while you're supposed to be relaxing on vacation. Then it's swimming. Can't swim, and you're going to want to do it more than likely. And lastly, hobbies, sports, and employment. If you work somewhere and there's a dress code, or you're involved in any type of organized sports and there's a dress code, you wear a uniform. If you're involved in anything else where there's a dress code or a uniform, talk to the people in charge before you get these piercings done. Chances are there's something in there that says that you can't have these. These are not going to be a piercing that you can take out and leave out for an extended period of time and not have issues putting it back in, especially during the healing process. I don't want to suggest that you get these done and then go to whatever the event is, and then only to find out that you either have to remove the jewelry or not participate. It's going to be one of those go home or take them out. And there is no way to hide these, especially during the healing process. So talk to the person in charge and verify before getting the piercing done. Don't ask for permission or apologize later, because it probably isn't going to work out in your favor. Well, that's all I have to say about shark bites today. If there's anything you'd like to add, please do it in the comments. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you are in the Des Moines, Iowa area, I hope to see your body piercing needs in the future. Have a good day. Take care, and we'll see you in this next video. Thank you for watching, too.